Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm an inventor of ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headache, pain and fatigue before I invented ASTR. Alright Eric, tell me what's going on with your right shoulder and elbow.
So I have a lot of tightness in my shoulder.
Okay.
And caused me to tear, moderate tear my UCL for throwing.
So how long your shoulder tightness going on?
Probably like 4 years.
Okay, so how did you injure your shoulder?
I think it was just bad stretching.
Okay.
And it was just built up over time. I got these knots in my shoulders now. So.
Have you had any treatment for the last 3 years for your shoulder or elbow?
I've done a little bit of physical therapy, and that's helped a lot with the looseness, but the pain's still always there.
So how we aggravate your shoulder pain, and how much pain from 0 to 10?
When I throw, probably like 5, 6, maybe.
Okay.
And then just by throwing. Yeah, and like a 5, 6 pain.
So, but you like daily activity, it's okay.
Yeah, it's fine. When I weight lift, it's a little tight, but that's pretty much it.
So it's okay to take your shirt off. We want to see, like, because before you showed me like you had that like kind of clicking on your shoulder.
Yeah.
So let's do the motion that
makes it clicking.
Yeah. Yeah, definitely can see that. It's kind of unstable a little bit. Is that painful?
No, not really.
Okay. So we'll have you come outside and do some throwing and let me know.
With the shirt on or shirt off?
Without, so I want to see your, because we're going to do that treatment too. Okay. And you let me know how much pain and where did you feel it?
There's no pain.
Or tightness?
That was, everything's fine going up, but I feel like once I release it, that's when everything's like, kind of like, that's why my shoulder moves the most.
Oh, you feel like unstable when you release it?
Yes.
And is that the uncomfortable feeling?
Yeah.
Okay.
That's when all the pain kicks into.
After the release?
It, yes.
Okay. So you have co-contraction issues in your shoulder. And how much pain when you release it?
Like a 2 or 3.
Okay. Right. I'm gonna do 10 and we'll see, because I want to aggravate your symptom to see, and we'll try it again after the treatment. And you feel it all in the back, yeah?
Yes.
Are you counting?
Yes.
If you're not counting, we're gonna do 200, okay? How much is now?
10.
Like how much discomfort?
Pain? Like a 2. I feel a little popping too.
Okay.
Right around here.
Did you have any issue with your elbow?
No.
Okay. All right. So we'll have you have a seat on the table.
Okay.
Actually, we'll have you sit on the side. I will move here, and you're gonna face the wall. Okay, everything should be pain-free, okay?
Okay.
This knot you told me, like you have it for several years?
Yes.
That's very thick.
Yes.
This one. Very thick knot. Make sure what I'm doing is not painful, okay?
Okay.
How does it feel?
Okay.
So the pain increase when you play, and it just you do it for a long time, yeah.
Yes.
Okay. So you injured your elbow too when you were playing?
No, I was just playing catch, and I was coming back in from long toss, and I felt a little pop. I'm like, oh, that was a little weird. But there was no like there was only like a little, very, very like slight pain, so I didn't think anything of it. And then the next day, I can straighten out my elbow.
That's how long that was ago? Like how long?
How long? Probably a month.
A month ago.
Month and a half ago.
That's when you torn your UCL.
Yes.
Any neck issue?
Yeah, right. Like the last, kind of like the last month, every time I turn my head, this part of my neck would hurt.
Okay, let's face me. Yeah, I want to see a range of motion for turning your head.
Sir?
That's limited actually. Yeah, back. Forward. So, you feel it more turning this way?
I feel a little tightness turning this way, yeah.
Just remember how far you can look this way.
Yeah.
Okay. So you feel it right on the trap, yeah?
Yeah, like right
In
here.
this area. Did you hit your head like you had any sports injury before?
No.
Okay. So we'll have you fix this. And that's happened for months now or for a while?
Probably like a month.
A month. Turn it and tell me how that feels.
A lot better.
Mm-hmm.
Yeah.
Okay. Is it back to normal? Or
Yeah, it's back to normal.
Back to normal?
Yeah.
But this scar tissue is the thickness of his trap. Like, I can feel it here superficially. That's mean it's the thickness of the lens of the muscle here. And I will show it to you with the scar tissue tool. You will see redness and you're gonna feel it actually. And this is the one that you had like several years to have hard time to break it, yeah?
Yes.
Do you do a lot of shoulder shrug exercises?
No.
I want you to avoid if you do any, want to make sure you don't do any shoulder shrug exercise. And you will see more redness where you have a scar tissue. See, it's the whole area, it's not like a spot. And I'm doing the back here, and the back is fine. Normal skin color. There's like a little bit scar tissue in here, the spot. The whole area here is scar tissue. You can visually see it. That show you how severe. Is it too much?
It's fine.
Okay. And here is fine, nice and smooth. The tool is going here. Just a little bit.
Can you feel it?
Yeah.
Wow.
Do you want to feel it?
No.
So.
But you can feel it as you're rubbing through it, you can feel it?
Yeah. So basically you're going to feel like, if it's normal, you will feel nice and smooth.
Mm-hmm.
If you have a scar tissue, it's like you feel you're going over a rock.
Wow.
Or a bump. And sometimes like you feel like you're going over a washboard, like grinding. And you will see with the tool vibrating more, and it's just going over a hump.
So with that tool, can you rub it out?
Yeah, we can break it. So how long it's gonna take? It depends on the patient. Some patient like it could take them one treatment and actually we dissolve it. It depends on how fast the person internal healing cycle. If their body is slow, that may take time. And also the size of the scar tissue. So if you have something like a tennis ball here, that's going to take us a little bit time to work on it. Than if you have a smaller scar tissue.
If you break up scar tissue, is it completely dissolved then at that point?
As long as you follow the ergonomic and the
Okay.
do's and don'ts, I give it to the patient. So I go over like what you should not do so you don't cause this issue. Because bad posture is going to cause it. Bad mechanic while you're throwing, that's going to cause it. So I have to go over the right way of doing things. It's like, you eat healthy, you decrease your risk of diabetic blood pressure and stuff like that.
Okay.
You're doing the right thing with your body, you lower the risk of having a scar tissue in the same area. Because, okay, let's say I release this, and you went back and slouched forward and have the bad posture. So that's a trigger.
Okay.
Does that make sense?
Yeah.
So yeah, we have to do like, it's not only working with the tools, it have to change a lot of bad triggers. Yeah, and here, you see, I'm just working in the back. There's no discolorization. It's all in the front here. Okay, and we'll see it here.
It's super red there.
Yeah, you
From that
see
area.
that?
Is it? Okay.
Yeah.
Super red.
You can, it's
Yeah.
very easy to see. And, oh. This is like, the scar tissue is like, it's, the tool is stuck in the scar tissue. You see that?
Yeah.
Like, you see that bump here?
Right.
It's just stuck in here.
Yeah, and I think you had bicep tightness too, right?
Probably.
Yeah, I will not be surprised. So we'll see. This is a big knot here. And that's gonna cause injury in his elbow. So, because you told me you had like fractured your
Yeah, it's probably
your elbow.
Yeah.
Why you fractured? You don't have a full range,
Right.
range of motion, so you stress the joint.
Huh.
That was compensating.
Wow.
That's a big scar tissue here. So did you were like wearing a splint? What happened after that?
They just said not to throw.
Not to throw, but he did not put any like splint or anything. Or
No.
things.
No.
That's a thick one here. Yeah. But you will notice probably will get rid of this faster than this because the size of this one is really big.
You can see the redness on that too.
Yeah. Okay, I want you to tell me the difference now. Can you feel any difference here in this one?
Yeah.
What the difference?
This is more rocky.
Yeah.
This is more rocky right here.
Mm-hmm.
It's not smooth.
Mm-hmm. And also here. So he has, and it's not too bad here. You
Yeah.
feel this one here?
Yeah.
It's just a little like
A little
a little grain here.
Uh-huh.
This is a kind of like a pea, you know.
Uh-huh.
This is like a golf ball. So we have all type of different
Wow.
sizes. Yeah. Is it too much here? Okay, let me do this area. Is that painful here?
No.
I'm surprised actually, because he has more scar tissue here and here, and not much here.
Yeah.
And that's our sign. This was compensating for all those big ones,
For sure.
you know, because usually when I see like patient with the elbow, you will feel a lot of scar tissue around the elbow.
Mhm.
If that's it's a little bit scar tissue, but it's not bad. And here is not too bad here. You slouch forward a lot, yeah. Sit up nice and tall. Okay, good.
Good posture.
We're gonna work on that. Okay. Your triceps is not bad. Feel
Mm.
that?
Yeah.
Really not bad.
Uh-huh.
It's all in here.
Wow.
Is it too much?
No, you're fine.
Mm-hmm. So is it easy to tell now the scar tissue?
Yeah.
Yeah. And the good news is actually, you will notice with the treatment,
Uh-huh.
well, the thickness and the width of the scar tissue should be shrinking. And visually, like in the few treatment, you will see it's not totally red, it's just smaller spots. So you can, I actually initially, when I was working on ASTR, I was measuring all the patient, the size of the scar tissue,
Mhm.
to see how they respond to the treatment, and what we noticed, it just, the size started to decrease. So let's actually turn around. I want you to move your neck and tell me, you still feel it or it's gone?
Yeah, it's a lot better.
Is
Yeah,
your
it's
neck
all
pain
better.
is gone, or
It's gone.
how much pain in your neck when you were turning before
There
you
was
started?
a lot. I couldn't even turn my neck this far.
Okay, how much in your neck pain before we started? I should have asked you this.
Probably like 3 or 4.
Okay, but now it's fine.
That's
Okay.
fine now.
Okay.
I could just still feel tightness.
Of that big scar tissue.
Yeah.
You're gonna continue feel it
Yeah.
because we did not totally get rid of it. It's gonna be the end range of motion. So, Let's do some throwing, but I want you to really drink water
Okay.
and see how is your throwing now. And I want you to try to pop it, what you did before, and tell me, does that make...
Breathe to your way.
Wow.
What?
It's less. It's not coming out as much.
Yeah,
Wow.
that's nice. It's that the big knot in the trap.
That was causing that whole popping.
It's a lot better. It's a lot better.
Let's do 10, okay? Because we did 10 before. So if he's stuck in the proliferation stage, it's just gonna take us the time to break this big knot, and hopefully the goal is to make it not popping at all, because that's a risk of injury.
Okay.
That popping is compensation. His muscle is not totally stretching to do the range of motion. It goes over his bone to compensate. So we don't want that. So the goal is to hopefully get you. Did you do 10?
Yeah.
Any pain, discomfort?
It's a lot. No pain.
Okay, so you had physical therapy before. Can you tell the difference between ASTR and the physical therapy you had?
Yes.
Mm-hmm.
Yes.
What's the difference?
A lot faster.
Mm-hmm.
A lot looser.
Mm-hmm.
That's pretty much it. Feel a lot better though.
Awesome. Thank you.
Feel
free to subscribe to my channel to get helpful tips on how to relieve pain and watch real treatment videos. There are over 45 studies that support ASTR treatment model. If you are a patient and would like to schedule an appointment or treat yourself at home, check the link below. If you are a healthcare provider and would like to receive ASTR training and buy ASTR instrument, check the link below. See you soon.